Welcome back to our Bluesy Water channel. Today I have Dr. Eric Zeminski. Is that correct pronunciation?
Zaremski. Zaremski.
Zaremski, thank you.
Yeah.
He's a holistic biological slash ozone dentist out of California, and he was very, very generous to do some education with me after I have one of the most invasive dental surgeries. This was about a month ago, and by the way, I thought I was going to die, and I feel actually fantastic a month later. And this is partially due to Dr. Eric's advice with ozone. The purpose of this video is we want to help everyone become aware of the options of what holistic dentistry is and really understand it so that you can make an informed decision about your dental care. There are some towns that have a lot more availability and others that don't. However, even this information, if you learn it, there are ways to potentially incorporate certain holistic skills with your regular dentistry. So this is a really in-depth dive into what we call holistic dentistry. Real quick, I just want to describe my procedure. And I'm very holistic oriented, so I did a lot of therapy to support my surgery. But I had a wisdom tooth up under my eye socket. I had a cyst in my sinus. They actually had to extract two teeth, pull out the cyst, and pull out the wisdom tooth. Quite intense. Half the battle is I'm very holistic, so recovering from the antibiotics and recovering from the oxycodone, they put me on severe pain medication, was significant. And part of what we're going to discuss today would essentially allow you to have much less pain if you had a procedure, so you don't have to do as many pain meds. And pain meds are no joke. They can really create side effects and also minimize or reduce the risk of infection. So anyhow, welcome. And let's see, let's just start with just a general kind of highlight and overview of what holistic dentistry is, a little bit about yourself, what you do, your practice. The floor is yours.
Thank you very much for having me, Andrew. So I've been practicing dentistry probably for, I don't know, a little over 20 years. And probably the first 5 or 6 years I just drilled holes in people's heads, and just like every other dentist in the block. And then I think one of my patients came and said, I use oregano and rosemary in my mouth. Is that good? And I had no idea what she was talking about. So they were in my garden, but I had no clue. But it turns out those are, two of the most antimicrobial herbs that we have out there. But I realized at that point I needed to educate myself. I needed to learn, what my patients were talking about, so I could have an intelligent conversation with them. Somebody gave me an ozone, and then said, figure it out. How do you use it? I thought I was going to kill somebody with it when I first got my first ozone machine. But I took, everybody's class. Ozone community in general, the medical dental ozone community in the United States, or at least actually in the world, is not that large. There's not a lot of practitioners. There's probably in the thousands practitioners that use ozone in their practices. So I learned pretty much from everybody in the world. Everybody had something to offer, and I learned from it, just about everybody. And then I started teaching other dental offices how to use ozone. So I think, you obviously learned by teaching. So that was sort of my journey with ozone. And I think it just started, it opened a window for me. I think ozone, if people are willing to start using or learning about alternative therapies, I think they have an open mind. So you talked about the holistic label of dental. And I think that it's sort of a dynamic moniker. I think it changes as we go along and we learn more. Yes, you could say that you put white fillings in and you don't do silver fillings, and you'll be a holistic dentist. But I think it goes a lot farther than that. And I think it's, like you said, I think traditional treatments that we have had in the past don't go as far, and they're not as comfortable, I guess. People expect to go to the dentist and they expect to hurt afterwards, and I don't think that should be the case. I think that that in your case you had a really, really massively invasive, extreme surgery, and it was done in a traditional way, and you were given traditional aftercare advice. And so I think that with a little bit of knowledge, and we could label it holistic, we could label it alternative, label it anything we want. But I think that, like there's a 6-year half-life on antibiotics in the gut. So why do we want to destroy our gut so that, we can have the bugs? But and something, another tool like ozone or lasers, we can reduce that bacterial population or the pathogen population quite a bit without having to use antibiotics. So I think that plays a big part in the definition of holistic. It's also for years we've sort of chopped off the head and said in a way and said, well, the mouth is different than the rest of the body, but it's all connected. And so I think that holistic moniker needs to include the rest of the body. I mean, I know as a dentist, I'm not a real doctor and I'm not supposed to be treating the rest of the body. And I don't, certainly, but it's all related. And I have to understand that, those upper first molars are related to gut, the incisors in front are related to the urogenital tract. And so I need to look at the whole body. And I think that's what more of a holistic definition needs to include. It needs to include all that and a referral maybe to the medical side of hey, there's a gut issue here, or there's another issue that we might be looking at it because you have a compromised tooth in that meridian. So I think
Oh,
that
yeah,
that
by the way, just to interrupt real quick, this is one important thing we're bringing up here. For those who are not familiar, the Chinese meridians are like circuits in the body. I actually had a bad tooth, and my shoulder and my elbow were hurting. And when they pulled that tooth, the pain went away. And it turns out, I do Chinese medicine, it's the lung meridian. And even as much Chinese medicine as I was practicing in body work, I still didn't think about every tooth and which meridian it affected. So that was immediately as when I had that tooth pulled, pain gone. So the meridians are literally like circuits, and if you have a bad tooth, it can have a problem. You just need to know the pathway of the circuit. So when we talk about liver or gallbladder, spleen, something, these are Chinese terms for circuits in the body, and the teeth are part of the circuitry. Okay, sorry.
no, not at all. I appreciate it. Back in the 50s, in the early 50s, a couple guys got together and they combined the Eastern and Western philosophies. And when you talk about the Eastern meridians, they combined those with Western traditional care, and they kind of gave an amalgamation of those two philosophies and came up with a tooth meridian chart. So you could Google tooth meridian chart, and you could see what body systems and parts are related to each tooth. And I think that's where it came. And if somebody say they have a root canal or they have a metal crown or a silver filling on a tooth, it's going to block, just like you said earlier, it's going to block that energy from flowing through that whole circuit. So if we think of the circuit as a tooth related to a body part, it's almost like a racetrack. Well, if you have something that's blocking it, it's going to be a speed bump or a brick wall that's going to stop that energy flow. And like your shoulder was affected by the tooth. Take the tooth out and the shoulder gets better. I'm not saying that we should start taking teeth out to fix our body parts, but in some cases we almost have to. I think the holy grail is, I learned as a dentist in dental school, is that not to take teeth out. Is original equipment is the best. But I had one case where a fellow came in and he was in his early 30s, real young, and he had 2 root canals up on the upper left side, and those were gut related. They were on the gut meridian, and I asked him if he was taking medications. So, well, no, except that I take Prilosec to go to sleep every night because my digestion's so bad. And so we took the teeth out, and he would cut his Prilosec in by 80%, something like that. So it made a huge difference in his life. So yes, there are cases like that where it's we have to look at how severe that's affecting the body parts. And in your case, the shoulder was really affected by that tooth. So I think that plays a part in it, and that plays a part in the philosophy. You can also do there's other things like muscle testing, where we test the muscle strength of your resistance in your body in terms of materials that it might like. We can talk about frequencies or energy modalities in terms of healing. Can talk about light therapy. So I think that all adds into that holistic moniker, and I think you have to consider all that. and not really discount it. I mean, I think traditionally we've learned to discount, anything that's alternative, and I think that the holistic moniker needs to incorporate all that and to look at it and see what works for that particular patient. There's so many different modalities out there. I mean, we can't throw everything at one patient, but there's certainly, maybe three or four different modalities that might work. And we just need to be informed about them and how they work and how we would use them on a particular patient or in a particular situation.
Now, just one thing, I teach and I work with medical ozone, so I understand it very deeply. You can do various what's called insufflations. If you do IV or a rectal insufflation, it's going to go blood systemic. If you go up the nose and hold your breath, that's called a nasal insufflation, and it flushes out the sinuses. You can go through the ears and get to sections of the brain. The thing with the infections in the mouth is they can be very concentrated, and you can get an abscess. So you really can't do these general insufflations and get too deep within that area where the infection is. So putting a needle strategically in the right area by deep in the gums is critical to getting that deep ozone insufflation and mitigating an infection. But also, you were telling me with the surgeries, if you do that right, during the surgery and periodically after the surgery, the patient's going to, first of all, be prone to getting any infections, and also the pain is vastly reduced. Is that so? It's important to understand the strategic application of ozone in dentistry, because if you're listening to this and you're into ozone, this is where the strategic insertion of needles is very important.
Yeah. Yes, there's a lot of information there in that paragraph that you spoke. Um, yeah, so you had a very traditional type surgery, and I think if that practitioner had known how to use ozone, your post-operative scenario certainly would have been a lot more comfortable. I think we both understand that. So with ozone in particular, and ozone therapy in dentistry, I think there's two ways to approach it. There's a topical application, and then there's an injection application. And so you're talking about, yes, we're talking about a needle, but it's a very, very tiny needle. It's the size of a diabetic needle. So it's not really the traditional, pokey poke with a dental needle where it hurts and there's pressure and this and that.
Right,
So
right.
it's not. I mean, yes, you do feel poked.
I did it, and I can attest that it's like nothing. The needle is so thin. I thought I was all freaked out, and Dr. Zaremski said, "You can do this." I did. He explained the process. Because I'm a practitioner, because I'm not aware, because I have done a lot of ozone. When I went to actually do it, minimal, very simple, very easy. Now, I'm not saying anybody should do this on themselves, but if you think needle in the gum, you're going to freak out. It's nothing like that. So it's very, very low key as far as the pain. I mean, you hardly feel it going in, and but very, very healing once you shoot that ozone in there.
Yeah, of course. And ozone typically is a gas and it comes out, and that's what we're typically injecting. And it's almost as if ozone has a brain because it really goes to the places that it needs to help heal the body. It probably heals things 3 times faster in the mouth than normal. It reduces pain. People can come in with like in my county, I will refer people sometimes to the oral surgeon, and they come back with what looks like they used a chainsaw on it, and it's pretty beat up, and they are still in pain a couple of weeks later, and I can put ozone around that area and inject ozone in that area, and they walk out without pain. So it's pretty immediate, and I think, and in terms of without, I mean, not everybody's obviously going to go through oral surgeries, but a lot of people have sensitive teeth, and we can put ozone gas on the sensitive tooth, and we can desensitize it forever. So they can go eat ice cream. There's a myriad of different ways we can use ozone in the practice, and not just in terms of surgeries. It will help whiten teeth, so it will make the teeth whiter than they are. It will reduce
Periodontal issues,
yeah,
right?
yeah, for sure. And I mean, we talked about that. Is that I mean, that's why people have gum disease. Is the bacteria hide in the gums, and then they poop, and then they cause all the plaque, and there's a whole scenario there. So if we can reduce the bacterial population in the mouth, And we can do that very easily with ozone because it just breaks apart the cell wall of the bacteria and they die immediately. So there's no way for them to reform or to mutate. So we can put ozone gas in topically on the gums or in between that space of the tooth and the
With
gums.
all, you can use ozone olive oil too, right?
Sure, we can take the ozone gas and we can bubble it through any vegetable oil, olive, sunflower.
But you can buy the oil, like ozone olive oil, and just apply it.
Yes, please buy it already ozonated. Don't try to ozonate the oil yourself because
Right.
it's
You need a
exothermic.
you need a massive generator to do it.
Yeah, and it's also it might blow up too, and it's a messy process. Anyway, so there's plenty of people out there on the internet selling ozonated oils. And it's great to use in the mouth. It's great to use outside the mouth on the skin, on a cut or abrasion. If your kid falls down, skins their knee, ozone oil is perfect to put on that. I think it's very multi-purpose and it stays stable for years. The ozone will actually bind to the oil, and some people say it will stay stable for 10 or 15 years. So it's very, very stable. You can also bubble the ozone gas through water and drink the water. So people with gut issues, sore throats or strep throat, things like that, they can gargle with it or they can drink it. It's going to help heal those things or change the gut biome. So I think it's very handy in that respect.
And one thing I really want to put a big asterisk, 3 asterisks. You can buy a home ozone system and do ozone at home and save yourself a fortune and have it for the rest of your life and just learn more and more. But if you own the basic system, it's called the medical ozone home system, and it's around the, it varies in price, but let's say around $1,000. If you want to get a really quality system with a great support, that's the one I sell for Promo Life. You're buying something for life that's an extraordinary technology, not just for the teeth, for the whole body, and you have your whole life to learn about it. It's easy to do, simple, and there's many teachings out there. We teach about it. So please understand, ozone is meant to be really something you do at home, you own it, and you can apply it. Now, I understand injecting the gums might be scary, and I'm not saying you should do that. I wish in every town they had 5 nurse practitioners that understood just how to. You go to them, you pay them $50, $100, and they do the process. You don't have to be a dentist necessarily to know how to inject gums. You need to know how to use a needle and understand, be taught and trained by Dr. Zaremski, sorry. In fact, if you are a nurse practitioner and watching this, we'll put his contact info below, and you want to learn how to do simple ozone gum therapy, that'd be great. You can make extra income learning a great skill.
No, I think that would be great. I mean, I would love for it. I'd love for medical practitioners on that side to learn how to go in the mouth because I think that, medical school, they were trained just not to basically ignore the mouth. It's just, and then they get scared going in the mouth and as dentists get scared going outside the mouth. So I think
Right.
that all needs to change. But Andrew was talking earlier about insufflation, and I think that's a big word, but it just means that we're actually putting gas into an orifice of the body. So we're putting it into the ears, the nose, vagina, or the rectum. And so that will all get into the blood system. That will get into the bloodstream and will affect the body systemically in a helpful way. So I think that from a consumer point of view, yes, PromoLife's got a great lineup of products. They have everything that you would need to do that. And we can certainly help if you need extra training or if you want to know how to set up the systems. And that's all stuff that you could do at home. Andrew mentioned IV treatments. That's certainly something that you're not going to do at home, and you're going to go to a practitioner who's going to do that. But that's another way of getting ozone into the blood and getting it circulated and fighting disease. Because
my issue with IVs, I always say, for the price of a ozone system, I mean, one 10-pass, what they call 10-pass ozone is almost around here. It's like $800-900. For another $100, you own your own system for life. And you can do, I've done what I call 4-pass rectal, but then we're getting too technical. If anybody wants to learn the ins and outs, the applications, I can help you and train you. Ozone therapy is a great therapy, but you have to be careful. You have to be careful and not to overdo it. And there are ways to balance it also, which we teach, which a lot of ozone practitioners sometimes don't understand the balancing therapies. but we teach everything and the how to complement it, how to make it more less aggravating oxidative stress. Keep in mind that ozone is what we call pro-oxidation. You're actually taking oxygen, you're igniting it with lightning in a machine, and it's fired up oxygen. So it's trial by fire. Its fiery nature is why it works. It causes a lot of enzymatic activity in the body, and it knocks out microbes. It's extremely catalytic, and I use the word catalytic. So you can have what's called oxidative stress reaction, but if you learn it properly, you're going to use this to your favor and understand how to do this. All right, that was my little sidebar on ozone.
You just threw a lot at everybody. No, don't think that putting the ozone into your body is going to explode. Don't get that from that
No.
talk. Not at all. I was just talking about oxidative stress, and we have a lot of stress in our bodies just in general during the day. We have environmental stresses, and obviously we have emotional stresses and all kinds of stresses. The ozone is more oxygen than oxygen, really, realistically. It's O3. So we've added an extra oxygen atom to an oxygen molecule. So that's going to create some sort of oxidative stress in our body if it's going to go in. But it's a good stress in a way because we're actually fighting disease. We're allowing the body to become more
Right.
healthful with it. And I think that's a good stress. And so actually ozone gas going into the body will change into peroxides once it gets into the blood because there's a lot of water. Remember, hydrogen peroxide is H2O2. Well, that water in the body is going to combine with the ozone to create the peroxides, and those are actually what's going into the body and changing and allowing the body to become more healthful and treating whatever issue or condition that person would have in that
And
respect.
I think there's more. I personally believe that a lot of enzymes, you're actually creating more enzymatic activity in the body. I can't prove that, but it's increasing the enzyme amount of enzymes in the body.
Yeah,
It's
the
just
body's so complex that I don't think we really truly understand everything that goes on when we administer an oxidative therapy to the body. I mean, that would include, hydrogen peroxide or hyperbaric oxygen. Anything with oxygen in it going into the body is going to be helpful. Anytime we oxygenate a disease state or a condition, we're going to reduce that disease state or condition.
now this is a little sidebar too. Uh, Getting a little, let's say you have Crohn's disease or colitis. Part of Chinese medicine is a term called qi stagnation. And I always use a simple term. I call it the grip of death. But when you have stress, you tend to do this. If you breathe in properly, and this is Dr. Buteyko out of Russia, you actually create vasoconstriction. When you do and in the colon, if you have this constriction, the gripping and the tightening, you can end up with all these colon diseases like diverticulitis, colitis, Crohn's disease. They're almost like you're twisting your guts. You're literally doing physical, even it's mental, mind, energetic, causing twists and turns. If you get these constrictions, this is in the gut, you feel depressed. It's very intriguing. So there's a point to this. If you do the rectal ozone insufflation, it not only has all this healing benefit of pathogens, but it actually causes almost like an unwinding of this constrictive field. You actually creates a great kind of letting go and relax. I find that this is true. It really, you get incredible relaxation, and it's almost like you lifted a burden. So it's intriguing, the mental emotional side also to doing rectal ozone insufflation. It's not so much true with, I think, the sinuses, but I notice this when people do, the rectal has a unwinding, letting go, relaxation, and you'll feel emotionally better. Now, you could just say it's the flooding of oxygen in a starved colon that's starving for oxygen. But you're going to notice it's almost like an amazing enema. If you do it properly, you're going to do a lot of pooping. It's very, very helpful for colon issues, just to let everybody know.
Well, we know that 80% of the immune system is in our gut anyway, so we
Correct.
really need to have a healthy gut. And you're right, going in rectally, it does yes, obviously it allows the gut to be more healthy, and it does get into the bloodstream because it has systemic effects. I think even sinus, even the ears, has systemic effects, and obviously doesn't probably go all the way down to the colon. So I think that getting in directly is more a direct route. But you're right; it does create health in the gut, and I think also drinking ozonated water is going to help from the other end, or taking capsules of ozonated oil is going to also help from the other end too. So there's lots of ways to address it and to address gut health in that respect. It also made me think of too. I mean, hemorrhoids and yeast infections; those are all issues that are down south of the border that a lot of people experience, and that's something where ozone is very, very helpful in terms of healing those issues, and they can be healed in 2 or 3 days, whereas normally it take 2 weeks. So
I am truly shocked because I have real talking about 80% of your gut immunity. I've done a tremendous amount of teaching and studying, and I know so many systems around gut health. It was literally about 3 weeks when, oh wow, my gut was straightened out. I thought it would take a lot longer. So I used my specialized program, which involved a lot of ozone. Plus, I have very, very highly specialized probiotics that I really like, that are very vigilant. So along with some other stuff, but I was really surprised that I could get it back that quick. That really a pleasant surprise. I kind of wrecked my gut to prove my own teachings. So let's go over. Okay, holistic dentistry is ozone's one critical piece. Understanding the meridian pathways, that this is a living system, and you include Chinese medicine. Checking for allergic responses to materials, so making sure you don't put something in the mouth the body's going to reject. That's another piece. Also, I was going to ask you about there's something when people look up biological dentistry, they're going to read about cavitations, they're going to read about root canals, and that's kind of two big buzzwords about, root canals are really bad for you, and you can end up with cavitations through improper dental procedures. Could you address those two?
well, of course. So let me rewind for a sec too, in terms of holistic dentistry or that moniker, or just going out. And if you're seeking a new dentist, or you're actually going to talk to your present dentist about all this, it's certainly something that if they're a traditional dentist, it's going to be certainly something that's outside the box for them. So I think we're just trying to give you knowledge to go to practitioners to have an intelligent conversation with them. So I think it's not something where we're not advocating that they're going to incorporate all of this tomorrow, but it's going to be a process, obviously, for them to understand that this is going to create a more comfortable dental visit for you. And I want you guys to remember that you're the consumer. You're paying money for a service, and you dictate not necessarily how it's done, but how you feel as a result of what's done. And so I want you to remember that in terms of insisting that you feel comfortable coming out of it. And this is just all knowledge for you to go back to them and to say, these are things that I learned. And it's something that that practitioner might think about incorporating into their practice to make it easier and more comfortable for them.
Okay, I would spin it. I'm going to respectfully disagree with you in this. What I know when I talk to any regular dentist, and I have this all the time with my patients. I went to my doctor and I told him about this, and he didn't respond, or he looked at me like I was crazy. I don't hold out much hope for you to even broach a subject of holistic dentistry to your regular dentist, regardless if you're in the moment dealing with something. If you want to have a general conversation when you're not in crisis or not in need, that's one thing. But if you're in a situation where you actually need care, find a holistic dentist that understands what you're talking. You watch this video, don't expect your regular dentist to go, oh yeah, this makes sense. They can watch this video, they can talk to you, but you really got to seek out the proper dentist, is what I'm saying.
Okay. I'm sorry. I agree with that statement that you just made. I'm talking about if you're interviewing a new dentist, if you're seeking a new dentist, if like you said, if you're just going to have a general conversation with your present dentist, I think these are all talking points that can certainly be brought up in the conversation. Yes, certainly if you're in the middle of of a treatment like you were, no, we're not going to stop, call timeout, and ask them to do things differently. No, that's I don't think I can advocate for that.
I even
That would
told
be
I even told my doctors, who are very nice, what I was doing, and they looked at me like, pretty much like I was bouncing air through their mind. They didn't want to disrespect me. I even tried to explain it in, very intelligent terms, but it's just they're trained a certain way, and unless they break that training, they're not gonna. They're trained to essentially reject what to be nice to you, but there's no, you can tell if the bells are going off, and I knew the bells weren't going off.
right,
But
right,
I did let them know I'm doing a lot of, I use the term adjunct protocols at home to support this process. So they can't totally dismiss me because they know I'm a practitioner, but they're not,
right,
it's not registering at all.
right. But if we're talking and educating today the general consumer who's going out and seeking say they're seeking out, just for example, a new dentist, I would like them to call up the office and say, can I have 5 minutes to talk to the dentist? What does that dentist think about what we've talked about today? And then, okay, so you talk to 5 or 6 or 10 dentists, probably not that many, but you find one who has an open mind, who's willing to say, I'll consider that, or we can talk about that more. The people that you talk to, they have closed minds, and I'm saying, okay, let's move on. Let's next on that one.
And
So
by the way,
I
there
know.
is uh, I called it Leo at DAMS, what does DAMS stand for?
um
DAMS.
yeah, it's the
Dentist Association, no,
yes,
dental
I forget.
something. It's a
Yeah,
holistic association that has a list of many holistic dentists around the country. We will post
right,
that number below. So if you're looking for a holistic dentist, we will post the number. You call Leo. He will give you the names of dentists in your area. If you just Google holistic dentist, unfortunately, somebody might do, like you say, not put silver in the mouth and call themselves mercury in the mouth and call themselves holistic. So people will use that word. You really do need to do what Dr. Eric says and really interview them in depth. And Leo has an authentic list of authentic biological and holistic dentists, so we'll post that number below.
great. There's also the Holistic Dental Association. There's the International Academy of Biological Dentistry and Medicine, the IABDM. There's also the International Organization of Oral Medicine and Toxicology, the IAOMT. So all three of those organizations will have lists of dentists in your state that are more holistic minded.
Now, if you have, let's get down to some of these topics. Root canals, which is a big kind of controversial area. Just from my understanding, after talking with you, if you have a root canal, short of pulling it out, you might go and get regular ozone injections to help with the possible negative side effects that people report regarding root canals. My understanding, and this might be naive, it's like a roulette game. Some people do really fine with root canals. Other people have a lot of consequential health issues. And there's a certain amount of microtoxins that come out of, once you have a root canal that develop anaerobic bacteria, and depending on your immune system, depending on a lot of factors, you can have no response, be fine, or have a slew of health issues. But it would sound like ozone is almost like something you would do around the root canal to kind of lessen the chances of a negative side effect if you choose to keep it. Is that true?
Correct. I mean, the reason that traditionally we do root canals is because bacteria has invaded and infected the nerve in the very center of the tooth. So if you can imagine a tooth, and the very, very center of it is a nerve, and it's pretty much the size of a thread. I mean, if you pulled it out, put it on your hand, it would look essentially like a thread. Um, so that's traditionally what we've done is we've removed the nerve, which is actually the lifeblood of the tooth. That's supplying all the nutrients, the blood supply, it's creating the health of that tooth. So now you've taken that out, and you've sort of removed all those nutrients and being able to supply the tooth. Um, I think that we could get to a certain point where we could reverse that infection in the nerve. I think we could use things like stem cell products that would actually, and ozone, that would actually reverse the infection in those nerves. Um, I don't think in all cases that would work, but it's also like we talked about earlier on those meridians. It's going to be a blockage. It's going to be because you've taken that lifeblood essentially out of the tube. It's going to create a speed bump on that meridian, on that circuit. So it's going to be a lot harder for that body part system, the whole body, to be healthy along those lines.
Hey, the tooth I had pulled,
Yes.
I relented to my dentist and I had a root canal. That's when my shoulder pain began and my elbow pain. So I had a tooth with a root canal pulled. So it was a root canal, and that's where my pain started. And then I said, screw this, and I pulled the tooth.
Okay.
So and I
Yeah.
actually pulled out $1,000 down the drain.
Yeah. Right.
So that shows you how committed I was to doing the right thing. But like I said, as soon as that root canal tooth came out, I felt like I had such a relief of energy almost instantaneously.
Nice. Nice. That's great.
So you're saying if you
Yeah, and
do
that's the way. I
stem
mean,
cell
for a lot
and
of people,
I'm sorry, you're saying if you do stem cell and ozone ahead of time, you can save the tooth in many cases.
we may be able to. In some cases, we may be able to. And I think if you do get to a certain point where you have to do a root canal, and that's the only option, I think doing the root canal with ozone is going to be a lot better in terms of treatment, because that bacteria not only infected the nerve, but it infected all the pores of the tooth and the surrounding bone. So traditionally, we've never addressed all that bacterial load. And so we really, with ozone, we know it's a gas. It will diffuse. It will kill most of that bacteria that's in that surrounding tissues. And so I think it's a huge benefit to do if you're going to do a root canal. If you're forced to do a root canal, if you do it with ozone, it's going to be a lot more healthy for that tooth. They've done studies where they've extracted teeth that have had root canals, and in 100% of the cases, they found really, really aggressive bacteria and fungi at the tips of those roots after the root canal was performed. So it's a toxic load in the body. It stays there. It's encapsulated because it's essentially, we've removed the root, we put filling back in. The filling is rubber based. It also has barium in it, so we can see it on X-rays. Barium is a heavy metal. So now we've created a heavy metal load on your body, in addition to all the environmental toxins that we get. And so that's creating a and in some people don't notice. Some people's systems they can overcome it, but like you, it affected you in a drastic way. So I think
it was early on. It affected my energy body, correct. My thinking was this: you don't take grandma when she dies and put her in a room and seal off the room. You don't do that. When a tooth dies, you don't put it in it, you don't seal it off you don't keep a dead thing in your mouth. That's my common sense ignorance. But I'm saying, let's say somebody has a root canal for 10 years. Wouldn't you recommend like maybe every 6 months they get some ozone injections around the root canal?
Sure. Yeah, for sure. I think that's going to be really, really useful to every 6 months, just to have somebody inject ozone around that whole area, around that whole side of the mouth, really, because the bacteria is going to travel, not just around that tooth, but into adjacent areas. So, yeah.
The ozone actually, because I heard, and again, this is just reading. When you seal it off, there's a wee bit of bacteria that starts to fester and grow. Like you said, they found it in every tooth. It's anaerobic in nature because there's no oxygen in the environment, and it builds osmotic pressure. They say, what I read is essentially it does get some nutrients and it poops gas, and the gas builds up pressure, and eventually that gas leaks out into the body. Is that accurate?
I'm sure. Yes. Yeah, I'm sure it is. It's not. It's obviously not a healthy situation to have, for sure.
So I'm
body.
wondering if you inject the
You also
ozone,
talked about
could it back
yes, go ahead.
channel into the tooth? It possibly could. If you inject around that root canal
What? I'm
area,
sorry.
could it? If you inject around the root canal area, could it essentially back channel up into the where the anaerobic bacteria are existing? Could it hit? Could it get to them?
It's really hard. It's hard. The tooth is encased in bone. So what we're doing by injecting the ozone is we're hoping that the ozone will diffuse, and it will diffuse through bone to the tooth. It's just really hard to get at that bone or the tooth that's encased in the bone because it has to travel so far,
Right.
and because it's sort of sealed off in that respect. So it's a hard situation to get at to heal. But yes, I mean, I think that's if the tooth is in the mouth, then I'm not advocating taking all root canals out. It's going to be up to the person, that individual person's decision-making process, what they want to do with that tooth. It's their body, and they have to make that decision for themselves after talking, today. Um, but I think that like you said, every 6 months, injecting ozone in that area is going to help a great deal.
If you want to keep the root canal, you could go for periodic ozone injections to sort of beat back its ability to spread in the body, I guess, to keep it contained and to really, if it starts to leak into the surrounding tissue, you would knock it out the infection. You could have the root canal pulled if you get a lot of health issues. Some people go and have their root canals pulled out, correct?
Right. And the thing there to make sure that happens, if you did, you really have to think about it long and hard. And if you decide to take that tooth out, the tooth roots are to the bone through ligaments. And so those ligaments are soft tissue, like in terms of versus bone, which is harder tissue. And so when the tooth comes out, you have to tell the surgeon to take those ligaments out. Otherwise, they'll get, when the bone heals, those holes where the tooth was, when those heal, that ligament will become encapsulated, and it's obviously affected because it was infected, that tooth that had the root canal. So it will just be another source of infection that will be encapsulated within the bone. And
Right.
so, and brings us to cavitation. For cavitations, traditional dentistry is not going to acknowledge the word cavitation. They're going to call it an area per tone or something to that degree. So you're not going to use cavitation to a traditional type dentist and have a conversation, because they're going to just discount that word, I think. But typically, what that would define is an area where the bone never healed. So a tooth came out, there's a hole there where the tooth was. The bone cell grow back into that hole, but it won't grow fully. It will be some sort of infection that will prevent it from completely healing healthy. And that's what we would consider a cavitation. And
Correct.
so years later, we have to go back in and clean that area out, and then allow the bone to heal healthy.
So the bottom line is cavitations occur from improper extraction procedures.
Well, I'm not sure that I would define it that way in terms of it could have done everything that they were supposed to have done. The body just healed something where it encapsulated some area in the bone, just never healed completely.
You said if you pull a root canal, you need to get the ligaments too, right?
Correct. Yes. Could be one source of it. There's many different reasons why a cavitation could develop. Okay, so we were talking about toxicity of materials, and there actually are a couple labs where we could draw blood from the patient, send it to a couple of these labs, and they can test the viability or the toxicity of the materials, and they test pretty much all the dental materials that are on demand with that one patient. So that can be an option. It's a cost, but it's also an option too.
What
Um,
about in general implants? Can you give a quick overview of that?
oh gosh, there's two types of dental. Oh, you have a space there. Replace that space, so you have a choice: leave it blank, and just function that way, or you can put a dental implant in there, and then they'll put a crown on the implant. So essentially, it's like a screw going into your bone. It has outside threads and inside threads, and so they can actually screw a crown into the inside threads of that implant once it heals into your bone. There's two types of dental implants. There's titanium and there's zirconium. So that's the material that these implants are made of. Titanium, most of the titanium out there that are for the dental implant materials are an alloy. So they have aluminum and nickel in them, also oxidized in the body. So that's basically rusting. So and they're also a metal compound. So it's gonna, when we talked about meridians earlier, it's gonna block that energy flow along that circuit. So I would recommend against the titanium implants, um, unless there's no other choice. The zirconium are not metal. I think anything you put in your body is foreign to the body. So I can't say that they're not toxic, but I think that they're more healthful in terms of putting a dental implant in. I would vote for a zirconium dental implant if I have my choice. Um, there are some practitioners who will argue that they're not as strong, but I think that they've been out for 10 or 15 years, and I think that the literature would support their strength, and I think that they're equivalent in terms of how well they integrate into the body and how well they stand up over time. So I don't think they're there.
What about the meridian? What about the meridian pathways?
There are some people who will argue that leukocyte levels go up when all implants are put in. So that's your white blood cell count. So it's really an individual matter. I mean, if you really want a dental implant, I would vote for having a zirconium in there. If you want to look at blood levels and where your leukocytes and blood levels are, I think that would help a lot. But I think that at least you would know where your body's at, a starting point.
Is there any way, like if somebody has a zirconium implant and is there any way to kind of do a balance? Can you do needles to kind of help reintegrate it and do some meridian type of work to actually sort of get the body to integrate and make peace with the implant?
I think when make peace, whether titanium or whether it's zirconium, I think if there's still a load of bacteria from the tooth that came out, then I think that's when the problems start to arise.
Right.
If that bacteria load wasn't managed well enough, then I think it's going to come back to kind of bite, and it's going to be a lot harder for the implant, whether it's titanium or zirconium, to integrate the body with that bacteria load that's there.
So please understand, this is very simple to visualize. This is very critical. We're circling back to ozone. If you have a very dense area and there's something develops in that area, think of a cyst or think of like a tumor, whatever. You want to be able to get into that very pocketed area and infuse that ozone so things don't fester in there. And it's very simple. You get the needle in there and you're going to bust up a bunch of potential infection. So it's so important. Let's say once you have that tooth pulled pre-implant, make sure you're just infusing the proper amount of ozone, X amount of visits, and keep that area pristinely clean. Then your implants procedure will go better. Things will go better. So it's very difficult if you have a pocket. How else can you get to it? Some people might do rife and frequency. We should touch upon that. There are people probably want to do rife. I actually have I'll show it to you. This is from Russia. It is very effective. I used it after my dental surgery. It's probably the next best thing I know after ozone. This is called a mission coil. It's very powerful electrostatic field. So it has that ability to permeate through deep into the cells. And it's like essentially like a lightning field. It has 300,000 hertz, very strong field, and it will actually infuse deep into the tissue. Is it as good as ozone? No, it's an adjunct to ozone, but it's called the mission coil. Rife is really supposedly you can zap a microbe with a certain frequency, but you don't know what microbes you have in the mouth, and you don't know what frequency to pick. This is sort of like a broad spread. It's like literally like zapping. It's called the mission coil, but you need to know which one to buy because the system I have is very strong. It is an adjunct to ozone. I always say ozone's the king of antimicrobial therapies. If there's any other therapies that you've ever seen that have that ability to permeate and knock out microbes that you know
Well, I think that any type of frequency, microcurrents are great, Rife is good, and what you have is great. I mean, any of those is light therapy. Those are all adjunctive therapies that are going to help a lot in terms of the healing process. Talking about post-treatment wise, it could be post-surgical or post-treatment, just any type of dental treatment that you have. Any type of frequency machine, Rife or microfrequency or which the frequency machines that you have, light therapy, those are all great adjunctive treatments to use that will help heal.
light therapy promotes tissue healing, but really, when it comes to knocking out the microbe, actually, this mission coil of all the things I've tried is the closest thing that I would say is it actually zaps microbes to ozone. That's why I've looked at a lot of them. But ozone, I say, is the king of ozone is the king of antimicrobials. And my only contention with ozone is you do it for a short period of time. It's good to have some follow-up therapy that is either is antimicrobial or inhibits the microbes from developing. My experience is that the mission coil actually can kill microbes directly. But I still say, oh, you do the ozone and you follow up with this therapy. So
sure.
Especially if you have like deep infections, these microbes are going to kind of travel through the body and figure out some way to survive. So your goal is to outsmart them. So 5 minutes of ozone is not enough because the rest that additional 23 hours and whatever minutes, that microbe's trying to figure out how to come back. It's like a bad basketball team that wants to win. Well, no, actually, they're very smart. They're very inventive.
They are.
They're going to travel your body and try to find a terrain where they can reinvent themselves.
Totally.
So,
even in the
think, I always say one person should think like a microbe.
Yeah, that's true. That's very true. So, well, hopefully this gave everybody enough information to go out and make a difference in at least their own treatments and how they receive treatment. So,
and if you're watching this, we'll get you the information to find a biological dentist if you're a consumer. If you're a dentist and watching this, you can contact me directly, and I'll get you Dr. Eric's phone number, and he can, if you want to train with him, even in incrementally, I'm sure you're willing to help out and train any dentist.
Of course.
And that's his kind of mission, is to help dentists pivot into a more expansive practice.
Yep. That'd be great.
Okay, so we covered, did we cover all the aspects of holistic dentistry in your mind?
Well, I think we could probably go on all day and to talk about all the aspects of it, but I think that gave us a good start. And I think I'm not trying to overwhelm everybody today. But I think that's certainly a great start of what we talked about, and that will give a lot of talking points if you're going to interview a dentist or talk to your present dentist. So,
and please contact me also, because I can give you your side of what you can do at home, what to look out for. At least, look, I had 3 or 4 hours to make a decision. There was not one dentist in Albuquerque who could do what Dr. Eric does. I got a great surgeon. I'm grateful. I had great, surgeon. I have a very good dentist, and they were very, they did within the scope of the way they worked. They did great work. And I had to do the repair, so to speak, after the surgery, and I learned. You learn from these experiences. So
Sure.
hopefully, this will give you you'll be prepared. You won't for the rest of your life. Maybe you'll prepare yourself and be mindful, so when something does arise, you'll be ready to make the right decisions.
Great. That'd be awesome.
And once again, I want to personally thank you for your generous amount of time you gave me to teach me and educate me on ozone post-op when I was sitting there in misery.
Of course. I'm glad it all worked out. I'm glad that you're back with the living right now. So that's great. And I appreciate you having me on. This was great to have a chat.
Okay, I think we're going to try to do another interview that's going to be addressed straight up to Dennis. We talked about doing that, right?
Yeah. Yeah.
Okay,
I could get more specific with how ozone works with different procedures and how I incorporate it. And
let's
then
do that.
we could also talk about biologics and peptides and things like that too. So
Let's because that'll be a good one because even the common layperson will enjoy that. Dr. Eric, thank you for giving your time and your expertise and helping people to learn more about holistic dentistry, and hopefully we'll get a few people to enter a whole new world, and then some, maybe one or two dentists.
I hope so. Certainly, that would be great. So thank you so much for having me on today.
Thank you.